Good evening, class. Today we'll be talking with my group about pediatric stroke. This is our case study. What is a stroke? We all know the stroke is when either blood flow is blocked or blood flow ruptures out of a blood vessel. Your two main types are ischemic and hemorrhagic. Ischemic stroke is when a blood clot forms and occupies that blood vessel so that blood doesn't get to the surrounding brain tissue and death happens. Now we know that it's a myth that only strokes happen with adults. Now strokes can happen in children, teens, babies, even unborn babies. The time when it is most prevalent is before and after, immediately after birth. Now, stroke is still the 10th leading cause of death in our society. Ischemic stroke is when blood supply is cut off to a part of the body, as I said, causing blood flow not to get to the brain tissue. Hemorrhagic stroke is when a ruptured blood vessel, a weakened blood vessel, spills blood into the surrounding tissue, causing swelling and damage to the brain cells. Now, a TIA is a mini stroke in the event that it's only temporary. So it's a warning sign that you need to get your body in shape, see a doctor, and modify some life factors that you have that are causing this type of symptoms in your body. Now, risks of stroke, modifiable would be high blood pressure, would be tobacco use, diabetes, cholesterol, sedentary lifestyle, diet, and exercise. Unmodifiable would be age, hereditary, race, and previous stroke. Now, we all know the acronym FAST. If you see someone who suddenly, their face starts to drooping, they have arm weakness suddenly, their speech is slurred, they have difficulties with their spoken speech, understanding, or with swallowing. These are all signs and symptoms. Call 911 immediately. Now, in newborns and infants, we'll see seizures, extreme sleepiness, tendency to use only one side of the body. In teens, you're going to see headache, nausea, vomiting, unilateral weakness, difficulty with speech, loss of emotion control, mood and behavior changes, and cognitive changes. Now, our case study is on Bart. He is a 15-year-old African-American male. He weighs 120 kilograms and he's 72 inches tall. Now, he has a very sedentary lifestyle, comes home after school, plays video games, and just chills. Eats whatever junk is in the pantry. Now, he has a history of obesity, pre-hypertension, and diabetes. And none of these have been treated with any type of medication. Now, Bart has the symptoms of these rapid onset symptoms at 9:15. 15 minutes after, he arrives in the ER. Now, his new symptoms are headache, vomiting, sleepiness, dizziness, and loss of balance and coordination. Now, his symptoms progressively became worse. Now, his blood pressure was 230 over 164. His pulse was 148. Now, his EKG showed AFib with RVR. Now, his NIH stroke showed a number 2, which was a mild neurological stroke. Now, his blood sugar was 181 upon arrival, and according to his mom, as I said before, he is not using any medications to treat his current issues. Now, his CT scan was negative for hemorrhage. His MRI showed clogged vessels. His echo revealed an ejection fracture of 60. Now, he is admitted to the neurology floor for at least 4 days for medical management and rehab. He is diagnosed with an ischemic stroke. Now, the two questions we have are, what are modifiable risk factors and what are unmodifiable risk factors? These are the two questions we will ask for this stage of this case study. Now, the non-modifiable risk factors include his increase in age, gender, hereditary, and race. Modifiable: blood pressure, blood cholesterol, diabetes, physical inactivity, obesity, poor diet, and poor lifestyle.